This year we presented updated results from a phase 1b/2 trial of single-agent Mosunetuzumab for treatment of previously untreated patients with diffuse large B-cell lymphoma who were elderly or unfit and thus unsuitable for receipt of standard chemoimmunotherapy. This is an important population since it comprises a lot of older patients. The criteria for this trial included those who were 80 years or over, or those who were 60 years or older, but with significant impairment to their functional status or medical status. And these patients don't have good treatment options. This trial, as a actually first experiment that I'm aware of, treated diffuse large B-cell lymphoma using immunotherapy alone. So these patients did not receive any chemotherapy, only Mosunetuzumab, which is a bispecific antibody. So it engages T cells, the natural immune cells that can attack the B cells of the lymphoma. And we have reported encouraging results both from the point of view of safety and efficacy. This study has been going on for several years, and we reported today data on the 54 patients who received treatment. So these patients, as I said, were either elderly or significantly impaired medically or functionally. They were not eligible by definition to receive the standard anthracycline-based chemotherapy like R-CHOP. And they received Mosunetuzumab monotherapy for up to 8 courses, so it was 6 months of treatment. These patients tolerated the treatment very well. The principal adverse effect of Mosunetuzumab monotherapy is cytokine release syndrome, similar to CAR T cells, but actually at much lower rates. So in this study, only 26% of patients, so 1 in 4, experienced any CRS. And all these events were of low grade, treated with suppression of fever. Only 1 person required corticosteroid therapy, and no patient required tocilizumab. So this treatment is actually safe for administration in the outpatient setting. To these older patients who are often frail and could not tolerate even high fever as the only symptom of the CRS. From the efficacy point of view, we knew that this was an experiment to which I have to say patients signed up and participated with a lot of enthusiasm. We ultimately observed 53% rate of overall response and 45% rate of complete responses as the best response. These responses appear to be durable. Out of 23 patients who achieved complete response in this trial, only 3 experienced relapse, and the other patients are continuing in complete remission. Now, many of them beyond 1 year. The median duration of response is currently approaching 3 years. So it appears that a small, well, actually not that small, probably a quarter of patients with diffuse large B-cell lymphoma who are ineligible to get other treatment can actually achieve long-term remissions. We're hesitant to use the word cure without longer follow-up, but at least long remissions without administration of any chemotherapy. Many of these patients could not have received any other treatment. Those who experience progression of disease on Mosunetuzumab often experience it very early during the first month of treatment and were able to move on to second-line treatment, either standard treatment or one of the second and third-line treatments that have been approved by the FDA in the past few years. So the overall survival of this results of the study are excellent, with 75% surviving at 1 year from starting therapy, which is actually a very good result for this population.